Hello dear patients, today we are going to discuss the case of peeling on scrotum. A man came to us and for a relatively long period of time he had been having peeling on scrotum that you can see on the picture. Also, due to an intense itch, there is infiltration, lichenification, that is thickening of skin of scrotum itself. There is reddening at the base. Peeling has a small character, that is, large plates are not detached. It looks like flour, covering the skin. He had been using hormonal ointments for a long time. They were prescribed to him in dermatovenerologic dispensary, where he was set a diagnosis of allergy. Here we suspected mycosis that had to be excluded. We took scraping for microscopy for fungus and the culture test for fungus. As a result of that, we found fibres of mycelium in scraping test and trichophyton rubrum fungus in culture test for fungus. What does this tell us about? It tells us that no skin manifestation should be left without corresponding analysis. And secondly, if some ointments do not help you, that doesn't mean you should keep using them till the end. You should cease using them and change something in diagnostics and treatment. For this patient, antifungal medications were prescribed internally, antifungal ointments externally. A course of treatment took 2 weeks, and after that all events were resolved. So 2 weeks after treatment, a control scraping was taken, and the culture test that was negative. Generally speaking, when there are such peelings, itch of scrotum, we find fungus quite often, even though it's not similar to it, and often other fungal lesions are absent. This is quite characteristic for skin of scrotum, as it has its particular features. Sometimes clinical manifestations may be even absent. You shouldn't search for some circles, spots, etc. During any itch on the scrotum, any kind of suspicious rashes and peeling, analysis for fungi have to be taken. It's even better to take scrapings and culture tests, because unfortunately, in some laboratories, microscopic scrapings are examined awfully. A qualified laboratory specialist is needed for that, but there are not enough qualified specialists in laboratories as well as in other fields today in Russia. So diagnostics should come before any treatment. If there are any skin lesions in the area of sexual organs, if there are suspicions on sexually transmitted diseases or skin lesions in the groin area, you can consult dermatologists, venerologists and urologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram